results to an actual facelift, and do you eventually need a facelift?
The first thing is that no one ever needs any of the stuff here. This is all want-based. You don't have to do it. You're volunteering for all of it. And so that's kind of important to keep in mind, is that we're here to try to improve people and make them better. And this is all sort of voluntary. You don't have to do it. Will it compare to a facelift? No, it's simply not a facelift. And a facelift is a little more complicated, with not just removing skin, but elevating tissues. And so it's not a substitute for that, but it's something that is done before, after, or as an adjuvant to a facelift. And let me tell you what I mean by that. I saw someone today who came in, a physician's wife, and she was telling me that she was concerned with jowling and tired eyes and a little bit of skin laxity on the neck, and was like a little earlier in the process. She said, do I need a facelift? Or I'd rather not if I don't have to, but is there something I can do now that would maybe push off having a facelift? And so that's the perfect patient for this procedure. So we recommended doing fat grafting to replace her volume loss, laser resurfacing to work on the sun damage and wrinkles, and then ellacor to provide tightening and texture improvement. And so she's pretty excited about that. And that will be a much smaller procedure for her to do. It'll really give her a nice boost. And then when she's ready down the road, we can do a face. And sometimes with the face, we'll also do an ellacor to work on texture, and especially around the mouth or across the forehead. And then after someone has a facelift, some years go by, a little bit more laxity comes along, we might do an ellacor plus minus a fat grafting procedure or laser as a tune-up to a facelift. So if you had a facelift in the past and you want a tune-up, this is a great thing to do. So it's done before facelifts, after facelifts, and then sometimes along with a facelift.